Hello, everyone. I am Trinity, and I'm a young Minecraft creator trying to get famous while teaching people about what I learn off the internet. Today's topic is May Mental Awareness Month, and I am going to be teaching you guys about these, I don't know what to call them because I don't want to hurt anyone's feelings, so let's just start. First one is schizophrenia. Schizophrenia is a chronic and severe brain disorder that affects a person's ability to interpret reality, manage emotions, make decisions, and relate to others. It is characterized by symptoms such as hallucinations, delusions, disorganized thinking, and a lack of motivation. Next is feeding disorder, which I have and I hate it. Pediatric feeding disorders, also termed avoidant restrictive food intake disorders, are conditions in which a child avoids eating or limits what or how much he or she will eat. This leads to problems including weight loss, nutritional deficiency, need for nutritional supplements. Next is problems with daily functioning. Is a chronic neurological disorder characterized by recurrent, unprovoked seizures. It occurs when temporary bursts of abnormal electrical activity in the brain disrupt normal nerve cell communication. A person is typically diagnosed with epilepsy if they experience 2 or more unprovoked seizures. Next is child abuse. Child abuse and neglect causes trauma, which can impair brain development and is linked to physical, emotional, and behavioral issues later in life. Understanding the symptoms and risk factors for child maltreatment can help child welfare professionals and others identify and build on families' strengths and natural supports to prevent and mitigate maltreatment and keep children safe. Next is ADHD, attention deficit hyperactivity disorder, is a lifelong neurodevelopmental condition that affects how the brain develops and functions. It is characterized by persistent challenges with attention, focus, organization, hyperactivity, and impulse control. Next is Alzheimer's. Alzheimer's is a progressive, irreversible brain disorder that slowly destroys memory, thinking skills, and the ability to carry out simple daily tasks. It is the most common cause of dementia, accounting for 60–80% of all cases. Next is suicide. Suicide is when someone tries to end their own life due to depression or suffering mentally and physically. I almost lost my girlfriend to this and I cried all day, but luckily I got her to think out of it. So I know this won't help, but please stay to live your pawsome life, because hate is strong, but something stronger than hate is love. Next is bipolar disorder. Bipolar disorder is a mental health condition that causes extreme cyclical shifts in mood, energy, activity levels, and concentration, formerly known as manic depression. It involves dramatic emotional highs, mania or hypomania, and lows depression that go far beyond typical day-to-day fluctuations. Next is DID or OSD. DID, dissociative identity disorder, and OSD, other specified dissociative disorder, are related trauma-based conditions where a person's identity, memory, and consciousness are fragmented. Both develop as a survival mechanism against severe, repeated childhood trauma and typically require specialized therapy to treat. Next is sleeping disorder. A sleep disorder is a medical condition that repeatedly disrupts the quality, timing, or duration of your sleep, leading to daytime exhaustion and impaired functioning. There are over 80 distinct types of sleep disorders that negatively impact both physical and mental health. Next is depression 10. Depression major. Depressive disorder is a common and serious mood disorder that causes persistent sadness, a loss of interest in activities, and affects how you think, feel, and handle daily life. It is a recognized medical illness, not a personal weakness, and requires professional care. Next is substance abuse. Substance abuse refers to a harmful pattern of using alcohol, illegal drugs, or prescription and over-the-counter medications in excessive amounts, or for purposes other than intended. This behavior leads to significant problems at work, school, or in relationships, and can cause severe physical and emotional harm. Next is OCD, obsessive-compulsive disorder. OCD is a chronic, long-lasting mental health disorder characterized by a cycle of uncontrollable, recurring thoughts, obsessions, and repetitive behaviors or mental acts, compulsions that a person feels driven to perform. All right, y'all, I'm sorry, but I'm really exhausted and can't do any more without getting distracted. So love yourself and goodbye. Jesus loves you, my beautiful lady Abrahidite loves you, Satan loves you, and to all atheists, I love you, goodbye.